are thoracic aperture and diaphragm and the chest wall and the intercostal spaces. Now we will first discuss about the thoracic apertures. This is the thoracic wall and it has two apertures, superior thoracic aperture and the inferior thoracic aperture. As you can see in this diagram. This one is the superior thoracic aperture, also known as the thoracic inlet. And this is inferior thoracic aperture. अब आ रही है आवाज?
अभी भी वैसे ही आ रही है,
कट के आ रही है आवाज।
मैम स्लाइड शो नहीं हो रही।
यस मैम स्लाइड।
स्टूडेंट्स अपना कनेक्शन चेक करें आप लोग, ठीक है? अगर आप मोबाइल नेट पे करें तो उसमें थोड़ा लैग आएगा जी।
हाँ जी बेटा, अब स्लाइड शो हो रही है आपको कि नहीं?
नो मैम।
मैम अब हो रही है।
मैम अब हो रही है।
बस ठीक है
बेटा, अभी दो लोगों को हो रही है, बाकियों को नहीं हो रही, तो अपना कनेक्शन चेक करें।
कनेक्शन चेक करें।
मेरी तरफ से कोई मसला नहीं है।
मैम आपकी वॉइस का मसला अभी भी आ रहा है।
So we were discussing about and the cervical region. हाँ जी, अब ठीक है आवाज। आपको आवाज आ रही है मेरी कि नहीं?
मैम सही नहीं आ रही आवाज।
Posterior, can you?
मैम आधी आवाज आती है, आधी चली जाती है।
हाँ जी बेटा, अब आ रही?
नो मैम।
Okay. Okay, wait for sure. Posteriorly, it is bounded by the T1 vertebra. On each side is bounded by the first rib and interiorly by the menobrium. The superior margin of the menobrium is in approximately the same horizontal plane as the intervertebral disc between the T2 and T3 vertebra. And first rib slopes inferiorly from the posterior articulation with the vertebra T1 to the interior attachment to the menobrium. This is a diagram for the better understanding. This is showing the T1 vertebra posteriorly. Interiorly, this is menobrium, and on each side, this is the first rib. This is forming the thoracic inlet, right? And this is the plane of the thoracic inlet. This is the upper border of the menobrium, and this is the upper border of the T1 vertebra. As you can see, this is aperture slopes inferiorly. This line. This is the plane of thoracic inlet. This aperture is 6.5 centimeter anterior-posteriorly and 11 centimeter transversely. And these are the structures which are passing through this superior thoracic aperture. It contains viscera, trachea, and esophagus, and it contains great blood vessels, brachiocephalic arteries, brachiocephalic veins, internal carotid arteries, and artery and subclavian. These are the apex of the right lung, and this is the apex of the left lung. This is all the structures which are present in the superior thoracic aperture. Next, we will talk about thoracic outlet. Thoracic outlet of inferior thoracic aperture. Interiorly, it is bounded by xiphoid process, HIATUS, and on each side by the lower 6 costal cartilages and the last 2 ribs, and posteriorly, it is bounded by the T12 vertebra, which is the last thoracic vertebra. It is closed by the diaphragm, which separates it from the abdominal cavity. Inferior thoracic aperture is closed by the diaphragm, while the superior thoracic aperture is an open kidney-shaped aperture. Next, we will talk about the thoracic outlet syndrome. Thoracic outlet syndrome refers to the group of clinical syndromes caused by congenital or acquired compression of brachial plexus or the subclavian artery and subclavian vein as they pass through the thoracic inlet. बेटा अब यहाँ पे एक पॉइंट है कि ब्रेकियल प्लेक्सिस एंड सबक्लेवियन वेन एंड सबक्लेवियन आर्टरी ये थोरेसिक इंलेट से पास हो रही हैं, जबकि हम यहाँ पे कह रहे हैं ये थोरेसिक आउटलेट सिंड्रोम है. बेटा फॉर द एनाटॉमी पॉइंट ऑफ व्यू, thoracic inlet is the superior thoracic aperture, while the thoracic outlet is the inferior thoracic aperture. While for the some clinician and some claim that the thoracic outlet is the superior thoracic aperture. ये सिंड्रोम भी कहते हैं और thoracic outlet syndrome भी कहते हैं. सेम थिंग होती है, तो इसमें कंफ्यूज नहीं करते. This will lead to the neurogenic thoracic outlet syndrome. And if there is compression of the vascular structure, including the subclavian artery or the subclavian vein, this will lead to the arterial thoracic outlet syndrome. And this will lead to the symptoms of the vascular conditions like weakness, cold, and the pain. And one of the complications of the thoracic outlet syndrome is the subclavian artery thrombosis, which leads with peripheral embolization. This is one of the complications of the arterial thoracic outlet syndrome. As you can see in this diagram, this is the
की क्या रीजन बताई हुई है?
sorry बेटा क्वेश्चन रिपीट करें.
मैम आपने बताया ना कि ये इनलेट में स्ट्रक्चर्स प्रेजेंट होते हैं, लेकिन फिर भी हम इसे आउटलेट सिंड्रोम क्यों कहते हैं?
बेटा क्योंकि एनाटॉमी में हम सुपीरियर थोरेसिक अपर्चर को थोरेसिक इनलेट लेते हैं, लेकिन मेडिसिन या सर्जरी वाले इसको लेते हैं थोरेसिक आउटलेट. ठीक है, ये डिफरेंस आता है. बुक्स में थोरेसिक इनलेट सिंड्रोम भी लिखा हुआ है और बुक्स में थोरेसिक आउटलेट सिंड्रोम भी लिखा हुआ है. ये चीज बताइए कि इसमें कंफ्यूज ना होना.
ओके मैम.
ठीक है, दिस इज क्लेविकल, दिस इज फर्स्ट रिब. और जब हमने फर्स्ट रिब की थी तो हमने उसके सुपीरियर सरफेस पे ग्रूव्स थे फॉर द सबक्लेवियन वेन एंड द सबक्लेवियन आर्टरी along with the brachial plexus. So whenever there is compression of the structure at this level, this will lead to the thoracic outlet syndrome or thoracic inlet syndrome. Now we will discuss about the thoracic wall. What are the layers of thoracic wall? Thoracic wall has 5 layers: skin, superficial fascia, muscles, pleura, and lungs. Outer layer is skin, inner to the skin is superficial fascia, right? And then we have muscles of the thoracic wall. And next, you can appreciate in this yellow color, this is endothoracic fascia. Endothoracic fascia, it covers the thoracic cavity internally. And in the blue, we have pleura, which are the coverings of the lungs, and this purple part is the lungs. Now we will talk about the muscles of the thoracic wall. With a muscle of the thoracic walls, we have axiopendicular muscles, which connect the upper limb to the thorax. And in the axiopendicular muscles, we have pectoralis major, pectoralis minor, and inferior part of the serratus anterior muscle, which you have already learned in your upper limbs. And there are two thoracic wall muscles, which include serratus posterior muscle having its two parts, serratus posterior superior, serratus posterior inferior. Next we have levator costarum. Next we have intercostal muscles, external intercostal muscle, internal intercostal muscle, innermost intercostal muscle, and we have subcostal muscles and transversus thoracis muscles. This table is taken from your KLM, and these are the two muscles of the thoracic wall. But the thoracic wall also includes the axiopendicular muscles, right? Serratus posterior superior originates from the nuchal ligament, spinous process of C7 to T3 vertebra, and it inserted on the superior border of the second to fourth rib. And it innervates by the second to fifth intercostal nerves. And its main action is elevation of the ribs. Next is serratus posterior inferior. It originates from spinous processes of T11 to L2 vertebra, and it inserts on inferior border of 8th to 12th rib near their angles. And it's supplied by the interior MI of T9 to T12 thoracic spinal nerves, and it helps in depression of the ribs. So there is difference between the action of the serratus superior muscle and serratus inferior muscle. Next we have levator costarum. It originates from the transverse processes of T7 to T11 vertebra, and it inserts on the subjacent ribs between tubercle and the angle. And they are supplied by the posterior primary rami of CA to T11 nerves, and it helps in elevation of the ribs, as the name indicates, levator costarum. So it helps in elevation of the ribs. Next we have external intercostal, internal intercostal, and innermost intercostal muscles. As you can see, internal and innermost intercostal muscles, they have two parts, interosseous parts and interchondral part. Interosseous part depresses the ribs, while the interchondral part, it elevates the rib. Subcostal muscle, it originates from the internal surface of the lower ribs near their angles, and it insert on the superior border of second to third ribs below. And it helps in same manner as internal intercostal muscles. And transversus thoracis originate from posterior surface of lower sternum, and it inserts on the internal surface of the costal cartilages 2 to 6, and it weakly depresses the ribs. And these all muscles supplied by the intercostal nerves. Now we will discuss intercostal muscles in detail. The outer layer contains external intercostal muscles. Intermediate layer we have internal intercostal muscles, and inner layer contains innermost intercostal muscles. Beta, again, this is the diagram showing the arrangement of the intercostal muscles. First layer we have skin, next we have superficial fascia, and then we have muscles. This muscle is external intercostal, the outer layer. The intermediate layer we have internal intercostal muscles, as you can appreciate. Next we have innermost intercostal muscles, right? And this is the neurovascular bundle, which is present between the internal intercostal muscles and innermost intercostal muscles. Internal and innermost intercostal muscles are separated from each other because of the neurovascular bundle, which is present in between them. This is basically the structure of the thoracic wall. Next, we will discuss external intercostal muscle in detail. It originates from the sharp lower border of the rib above and insert in the upper border of the rib below. Direction of fibers is downward and forward. An extension from the tubercle of the rib behind the costochondral junction weight is replaced by the external intercostal membrane. To understand the attachments and fiber direction of the intercostal muscle, See this diagram. This is the cut section. The outer layer of muscle is external intercostal muscle, which originate from the lower border of the upper rib and inserted on the upper border of the lower rib. You can appreciate or not?
Yes, ma'am.
Yes, ma'am.
Yes,
ठीक
ma'am.
है? अगर हम इन दो रिब्स की बात करते हैं बेटा, तो ये अपर रिब के लोअर बॉर्डर से ओरिजिनेट होता है और इंसर्ट हो रहा है लोअर रिब के अपर बॉर्डर पे. एंड द डायरेक्शन ऑफ फाइबर्स इज वेरी इंपॉर्टेंट फॉर द इंटरकोस्टल मसल्स. एक्सटर्नल इंटरकोस्टल मसल्स की फाइबर की डायरेक्शन inferior interior है. Inferior interior direction of fibers, right? And the extent of the external intercostal muscle is that it from the tubercle of the rib behind to the costochondral junction interiorly, and after the costochondral junction it is replaced by external intercostal membrane at this level. Beta, external intercostal membrane, also known as interior intercostal membrane. This one. ठीक है, costochondral junction के बाद external intercostal muscles interior intercostal membrane से replaced हो जाते हैं. This is all about external intercostal muscles, and they help in the inspiration during the elevation of the rib. Next we have internal intercostal muscles. Same. They originate from the lower border of the upper rib and insert on the upper border of the
Lower rib.
Lower rib.
rib below. And the direction of fiber is inferior posteriorly. External intercostal की inferior interiorly. ये देखो, inferior आ रहे हैं और interior आ रहे हैं, जबकि जो internal है बेटा वो inferior आ रहे हैं और posteriorly जा रहे हैं. ये देखो, direction entirely opposite है. Direction of fibers जो है बेटा ये आपको help out करते हैं ospec point of view से. So you should remember this. Inferior interiorly for the external intercostals and inferior posteriorly for the internal intercostal muscles. And what are the extent of the internal intercostal muscle? From the lateral margin of the sternum, it extends from the lateral margin of the sternum to the angle of the rib at this level. And after the angle of the rib, it is replaced by internal and posterior intercostal membrane. This one. ये point है posterior intercostal membrane or internal intercostal membrane, which is present posteriorly, while the interior intercostal membrane and external intercostal membrane, which is present interiorly, and they help in expiration. Next, we have innermost intercostal muscles. They originate from the inner surface of the ribs above, and they insert into the upper border of the second to third rib below, right? And direction of fiber is same like the internal intercostal muscle, which is downward and backward, also can call as inferior posteriorly. Next, we will talk about intercostal space. What is intercostal space? Any student can tell me?
मैम दो रिब्स के दरमियान जो स्पेस होती है उसे इंटरकोस्टल स्पेस बोलते हैं.
Yes, the space present between two adjacent ribs, right? Not between ribs, two adjacent ribs is known as intercostal space. And there are 12 pairs of ribs and 11 pair of intercostal space at the thoracic wall, right? Interiorly, intercostal space are lined by different structures like skin, superficial fascia, muscles, and posteriorly by the endothoracic fascia, pleura, and the lungs. Costal spaces are counted by palpating the sternal angle. And sternal angle is also known as क्या कहते हैं बेटा sternal angle को? कोई और नाम है इसका?
Angle of Lewis.
Yes,
Angle of
Lewis. Exactly. Intercostal space, there are 9 interior and 11 posterior intercostal spaces. Okay? And each space contains intercostal muscles and neurovascular bundle having intercostal nerve, intercostal vessels, including the intercostal arteries and intercostal veins. Now we will talk about intercostal arteries. We have interior intercostal arteries and posterior intercostal arteries. बेटा ये जो नाम है ना इंटीरियर एंड पोस्टीरियर इंटरकोस्टल आर्टरीज और इंटरकोस्टल वेन्स, बेटा ये इंटरकोस्टल स्पेस की पोजीशन के अकॉर्डिंगली इसको डिस्ट्रीब्यूट किया गया है. जो इंटीरियर प्रेजेंट है वो इंटीरियर इंटरकोस्टल आर्टरीज होंगी और जो पोस्टीरियर पार्ट ऑफ इंटरकोस्टल स्पेस में प्रेजेंट है वो पोस्टीरियर इंटरकोस्टल आर्टरीज होंगी. राइट? इंटीरियर इंटरकोस्टल आर्टरीज, interiorly we have 9 intercostal spaces, so that's why we have 9 interior intercostal arteries, and in the costal roof we have 2 interior intercostal arteries except in the lower 2 intercostal spaces. The upper 6 pair arise from the internal thoracic artery and the 7, 8, 9 pairs arise from the musculo-phrenic artery. Beta, this is sternum, and lateral to the sternum we have internal thoracic artery, which is the branch of the first part of subclavian artery, right? And it present laterally to the sternum on each side. So upper 6 pairs arise from the internal thoracic artery at this level, and 7, 8, 9 interior intercostal arteries, they originate from the terminal branches of the internal thoracic artery, which is musculo-phrenic artery. Next, we have posterior intercostal arteries. Each posterior intercostal space contains 1 posterior intercostal artery. So interior intercostal space में 2 interior intercostal arteries हैं, जबकि posterior intercostal space में we have 1 posterior intercostal artery. Right? The upper 2 posterior intercostal artery, they originate from the superior intercostal artery, which is the branch of the subclavian artery. ये देखो. This is subclavian artery, and from the subclavian artery arises costocervical trunk, and from the costocervical trunk superior intercostal artery originates, and which gives posterior intercostal artery. And from 3 to 11 posterior intercostal arteries, they originate from the descending thoracic aorta. This is aorta. So the origin of intercostal arteries are different interiorly and posteriorly. Next, we will talk about internal thoracic artery. As I just told you, it arises from the first part of the subclavian artery. It descends vertically 1 finger breadth lateral to the sternum. Sternum के laterally internal thoracic artery है, and in the 6th space, intercostal space, it gives 2 terminal branches, musculo-phrenic artery and the superior epigastric arteries. And besides these terminal branches, it also gives pericardiophrenic artery, which supply blood supply to the diaphragm. And it also gives interior intercostal arteries, perforating branches, and 2 terminal branches, musculo-phrenic artery and superior epigastric arteries. Next, we will talk about intercostal veins. Interior intercostal veins, they correspond to the interior intercostal arteries, and they drain into the veni comitatus of the musculo-phrenic and internal thoracic arteries. So interior intercostal vein, veni comitatus of musculo-phrenic and internal thoracic artery में ही drain होती हैं बेटे. जबकि posterior intercostal veins, they have different draining sites on right and left sides. First, second, and third posterior intercostal vein, they unite to form the superior intercostal vein, which drains into azygous vein on the right side. And 4 to 11 posterior intercostal vein, they drain into the azygous vein, and the subcostal vein also drain into the azygous vein on the right side. While on the left side, the first posterior intercostal vein, they drain directly into the left brachiocephalic vein. Second and third unite to form superior intercostal vein, which also drain into left brachiocephalic vein, while the 4th and 8th posterior intercostal vein, they drain into the superior hemiazygous vein. And the 9th and 10th and subcostal vein, they drain into the inferior hemiazygous vein. Azygous venous system you will discuss in detail in the next lecture with the mediastinum topic, right? ये सारा आपको डिटेल में करवाएंगे बेटा कल कि एजाइगस हेमियोजाइगस का सिस्टम क्या है. Next we have intercostal nerves. There are 11 intercostal nerves in the upper 11 intercostal spaces and subcostal nerve below the last rib. So beta, below the 12th rib, the nerve is known as subcostal nerve. So we have 11 intercostal nerves and we have one pair of subcostal nerve which is present below the 12th rib. Each intercostal nerve arises from the corresponding thoracic nerve. But as you can see in this diagram, vertebra has vertebral foramen, and in the vertebral foramen, spinal cord passes, right? And from the spinal cord, spinal nerves originates. And these spinal nerves has two parts, dorsal ramus and the ventral ramus. The ventral rami of the thoracic spinal nerve are known as intercostal nerves. So basically, intercostal nerves are the ventral rami of the thoracic spinal nerves. So we have typical intercostal nerves and we have atypical intercostal nerves. From 3 to 6, we have typical intercostal nerves, and from 4, 2nd, and lower 5 intercostal and subcostal, these are atypical intercostal nerves. Typical intercostal nerves, posteriorly, the nerve lies between parietal pleura and posterior intercostal membrane. Laterally, it lies between the internal intercostal and innermost intercostal muscles. And interiorly, medial to the costochondral junction, it crosses in front of the internal thoracic artery and it terminates as the interior cutaneous nerve. Let's follow this diagram for the concept of intercostal nerves. As I just told you, intercostal nerves are the ventral rami of the thoracic spinal nerves. This is. Near its origin is present between the posterior intercostal membrane and the pleura. This is pleura and this is posterior intercostal membrane. Laterally in the costal groove, it present between the internal intercostal muscles and innermost intercostal muscles, right? And near the costochondral junction, it pierces the internal intercostal muscle and external intercostal muscles to end as interior cutaneous branch which supply the skin. And in the lateral part, it gives off lateral cutaneous branch which further divides into interior and posterior branches supplying the skin. And in addition, it also gives rami communicantes, which is also known as communicating branches, which connect the spinal nerves to the sympathetic ganglion. This is sympathetic ganglion. So white and gray rami communicants connect the spinal nerves to the sympathetic ganglion. This is the main course and branches of the typical intercostal nerves. So the branches of the typical intercostal nerves, white and gray rami communicants, which connects to the sympathetic ganglion. Next, we have lateral cutaneous branch, which divide into interior and posterior branches. And we have interior cutaneous branch, and we have articular branches. These all are the branches of the typical intercostal nerves, which are from 3 to 6. Next, we will talk about atypical intercostal nerves. Atypical intercostal nerves, first intercostal nerve, which participates in the brachial plexus, T1. Second intercostal nerve. This is similar to the typical nerves, but the lateral cutaneous branch does not divide into interior and posterior branches. This one. ये जो lateral cutaneous branch है बच्चे, second intercostal nerve की interior और posterior branch में divide नहीं होती है, and it supplies the upper part of the medial side of the arm. So it's called as intercostal brachial nerve. इंटरकोस्टल ब्रेकियल नर्व जब आपने क्यूटेनियस इनर्वेशन अपर लिम्ब की थी तो शायद आपने ये टर्म सुनी हो. बेसिकली द इंटरकोस्टल ब्रेकियल नर्व इज सेकंड इंटरकोस्टल नर्व, and lower 5 intercostal nerve they supply the interior abdominal wall. This is all about the atypical intercostal nerves. Next we will talk about the applied anatomy. Needles introduced into the intercostal spaces to remove collection in the pleura. बेटा मुझे कौन सा स्टूडेंट बताएगा कि अगर आपने इंटरकोस्टल स्पेस में नीडल इंसर्ट करनी है टू कलेक्ट सैंपल फ्रॉम द प्लूरा, तो आप उसकी डायरेक्शन क्या रखते हो? Posterior?
Yes, ma'am.
हाँ जी, क्या डायरेक्शन रखते हैं बच्चों उसकी? Yes, in the lateral part of the chest wall, और बेटा upper border of rib और lower border of rib?
Lower border. Lower part. Lower border.
बेटा अगर आपको सेकंड और थर्ड, फॉर एग्जांपल अगर आपने सेकंड और थर्ड रिब के बिटवीन जो इंटरकोस्टल स्पेस है, जो कि सेकंड इंटरकोस्टल स्पेस होगी, आपने वहां पे नीडल इंसर्ट करनी है टू कलेक्ट सैंपल, तो आप किस तरह रखोगे?
थर्ड का अपर बॉर्डर,
थर्ड का अपर बॉर्डर, यस, टू अवॉइड इंजरी टू दी
जो सेकंड टू द न्यूरोवास्कुलर बंडल और एमंटल को.
तो हम अपर बॉर्डर ऑफ द थर्ड रिब पे नीडल इंसर्ट करेंगे टू अवॉइड इंजरी टू द न्यूरोवास्कुलर बंडल व्हिच इज प्रेजेंट नियर द लोअर बॉर्डर इन द कोस्टल ग्रूव, राइट बेटा? लेकिन अगर इफ वी हैव टू इंसर्ट इंटरकोस्टल नर्व ब्लॉक, तो बेटे अगर इंटरकोस्टल नर्व ब्लॉक है जिसमें हमने एनेस्थीसिया जो है वो इंट्रोड्यूस करना है, तो इसमें हमने जो नीडल की डायरेक्शन होती है वो हमने कोस्टल ग्रूव की तरफ ही रखनी है, क्योंकि हमें नर्व में जो एनेस्थेटिक एजेंट होता है ना वो इंट्रोड्यूस करना होता है. सो दैट्स व्हाई इन इंटरकोस्टल नर्व ब्लॉक द नीडल शुड डायरेक्ट टुवर्ड्स द लोअर बॉर्डर ऑफ द रिब, राइट? जबकि नीडल डिकम्प्रेशन वगैरह में आपके पास अपर बॉर्डर ऑफ द रिब है, जबकि इंटरकोस्टल नर्व ब्लॉक में नीडल डायरेक्शन शुड बी टुवर्ड्स द लोअर बॉर्डर ऑफ द रिब. ये चीज याद रखना.
No, ma'am.
No, ma'am.
No, ma'am. Okay, wait. Now you can see the slides.
Yes, ma'am.
Okay. Now we will discuss about the diaphragm. What is diaphragm? Diaphragm is a doomed musculotendinous sheet. It separates the thoracic and the abdominal cavity, and it has superior surface or the thoracic surface, and it has the inferior surface or the abdominal surface. But this is the simplest diagram to understand the surfaces of the diaphragm. This is the superior surface, and this is the abdominal or inferior surface, and they are central tendon and right and left doomed, right? So that's why हम इसको कहते हैं it's a doomed musculotendinous. So muscular part is the peripheral part, while the tendinous part is the central part. ठीक है? और ये जो muscle है बेटा, these are the skeletal muscles. The musculotendinous part of diaphragm. Peripheral part is the muscular, which is striated part, and the central part is tendinous, occupied by the central tendon. and the muscle fiber directed upward and inward, as you can see, fanning of the muscle fibers. In the center, we have central tendon, and on the periphery, we have muscular striated part. Now we will talk about the origin of the diaphragm. It arises from the circumference of the inner surface of the thoracic outlet. And muscle fibers grouped into three parts: sternal, costal, lumbar or vertebral part. And it also has medial arcuate ligament, lateral arcuate ligament, right crus and left crus. Sternal origin arises by two fleshy slips from the posterior aspect of the xiphoid process. So the sternal part originates from the posterior aspect of the xiphoid process, while the costal origin arises from the inner surfaces of the lower six ribs and the costal cartilages. Next, we will talk about the vertebral part. Vertebral part has different parts, which are right crus, left crus. And we have median arcuate ligament, medial arcuate ligament, and lateral arcuate ligament. This is the diagram. Okay. The white part is the central tendinous part. This red part is muscular striated muscular part, right? But you can just appreciate this structure. This is a projection-like structure. Okay, but say these are crus, right crus and left crus. Right crus is longer as compared to the left crus, right? And beta, you can appreciate these white lines, white boundaries.
Yes, ma'am.
Beta, these are arcuate ligaments, right? ये अभी हम डिटेल में करते हैं. The right crus arises from the sides of the bodies of L1 to L3 vertebra and IV disc, while the left crus arises from the sides of bodies of the L2 vertebra. Beta, this is right crus, which is longer because it originates from L1, L2, L3 vertebra and their intervertebral disc. While the left crus is shorter as compared to the right crus because they originate from the L1 and L2 vertebra along with the intervertebral disc. Okay? This is the right crus and this is the left crus. Now we will discuss about the arcuate ligaments. Arcuate ligaments, we have three arcuate ligaments. We have median arcuate ligament, we have medial arcuate ligament, and we have lateral arcuate ligament, right? With a median arcuate ligament, medial arcuate ligament, and lateral arcuate ligament. The medial arcuate ligament extends from the side of the body of the second lumbar vertebra to the tip of the transverse process of the first lumbar vertebra. This part is the medial arcuate ligament. This arch, right? And next to it, this is lateral arcuate ligament, which extend from the tip of the transverse process of the first lumbar vertebra to the lower border of the 12th rib. This is medial arcuate ligament and this is lateral arcuate ligament. Medial arcuate ligament is the tendinous arch in the fascia covering the psoas major muscle. This is medial arcuate ligament. You can see two muscles here or not?
Yes, ma'am.
बेटा ये जो मसल है ना, ये tendinous arch in the fascia covering the psoas major muscle, right? And the lateral arcuate ligament is the tendinous arch in the fascia containing quadratus lumborum muscle, which is the muscle of the abdominal wall. तो बेसिकली ये दो मसल्स के फेशिया हैं और उनकी ये टेंडिनस आर्च बन रही है, इनको हम आर्कुएट लिगामेंट्स कह रहे हैं। एक मीडियन आर्कुएट लिगामेंट है और एक लैटरल आर्कुएट लिगामेंट है, ये चीज याद रखनी है। नेक्स्ट आता है मीडियन आर्कुएट लिगामेंट। बेटा द मीडियन आर्कुएट लिगामेंट अब क्या चीज है? द मीडियल बॉर्डर्स ऑफ द टू क्रूरा are connected by median arcuate ligament which crosses over the interior surface of the aorta. This one. This is right crus and this is left crus. So plural of the crus is crura. So the median borders of two cruras passing in front of the aorta. This is aorta. And this is known as median arcuate ligament. So we have two crus, right and left crus, and we have three arcuate ligaments. Median arcuate ligament, medial arcuate ligament, and lateral arcuate ligament. This is the vertebral origin of the diaphragm. Next, we will talk about apertures of the diaphragm. There are certain openings and apertures in the diaphragm which give passage to pass the structure either from the thoracic cavity to the abdominal cavity or from the abdominal cavity to the thoracic cavity. So there are three large openings: aortic, esophageal, and vena caval or caval opening, and there are a number of smaller openings. Aortic opening is present at the level of T12 thoracic vertebra. Esophageal opening is present at the level of T10, and the caval opening is present at the level of T8. These are the openings. This is the aortic opening, right? This is the caval opening, and this is the esophageal opening. And these openings containing some structures. For example, aortic opening has aorta, thoracic duct, azygous vein, and hemiazygous vein. While the caval opening has inferior vena cava. Caval opening indicates it contains inferior vena cava, branches of the right phrenic nerve. And esophageal hiatus contains esophagus, vagal trunks, esophageal branch of left gastric artery, esophageal tributaries of the left gastric arteries. So there are three major openings: aortic, caval, esophageal, and there are minor apertures to the cruras for the azygous vein, greater splanchnic nerves, lesser splanchnic nerves, least splanchnic nerves, and hemiazygous vein. You can also appreciate the foramen of Morgagni. Beta is a space which is present between the xiphoid process and the seventh costal cartilage. This is seventh costal cartilage and this is xiphoid process. So basically it's a space, and this is known as foramen of Morgagni or the space of Flarin, which contains superior epigastric artery and superior epigastric veins. So these are the apertures and these are the structures which are present in this hiatus. Now we'll talk about the relations of the diaphragm. Beta, superior relation of diaphragm includes pleura, this one, and pericardium. While the inferior relation of diaphragm includes peritoneum, liver, spleen, fundus of stomach, and we have kidneys along with the suprarenal glands. These are the inferior relation of the diaphragm. Next, we will talk about the blood supply. Superior surface is supplied by the superior phrenic artery, branch of thoracic aorta, and next musculophrenic and pericardiophrenic arteries, which are the branches of internal thoracic arteries. And inferior surface is supplied by right and left inferior phrenic arteries, which are the branches of the abdominal aorta. Phrenic veins, the right phrenic vein ends in the inferior vena cava, while the left phrenic vein is often double. One branch ends in the left renal or suprarenal vein, while the other passes anterior to the esophageal opening to join the inferior vena cava. These are the venous drainage of the diaphragm. Next, we will talk about the nerve supply. Motor supply is the phrenic nerve, and the sensory supply, the central part, is supplied by the phrenic nerve, while the peripheral part, which is the muscular part, is supplied by the intercostal nerves, lower 5 intercostal nerves. where the two phrenic nerves originate in the neck and having the root value C3, C4, and C5. The phrenic nerves contain motor, sensory, and sympathetic nerve fibers. The motor supply of the diaphragm is the phrenic nerve, while the sensory supply, central part is supplied by the phrenic nerve, while the peripheral part is supplied by the intercostal nerves. What are the functions of the diaphragm? Is the major muscle of the inspiration. Diaphragm leads additional power to all expulsive efforts like sneezing, coughing, defecation, urination, and crying. In lifting heavy objects and in some muscular pump. These are the functions of the diaphragm. Next, we will talk about the clinicals of the diaphragm. Diaphragmatic hernias are the most important clinicals of the diaphragm. It may be congenital. It may be retrosternal hernia through the foramen of Morgagni or space of Flery, right? And posterolateral hernia through the foramen of Posterolateral. Posterior hernia due to failure of development of posterior part of diaphragm, and the central hernia because of the rupture of fetal membranous diaphragm in the left arm. So whenever there is abnormality of the embryonic development of the diaphragm, this will lead to the hiatus or small openings, which leads to the hernia. And these are diaphragmatic hernia, congenital diaphragmatic hernia. These are the sites of the diaphragmatic hernia. These are foramen of Morgagni or space of Flery. Right? These are the central tendon foramen, and these are Posterolateral foramen, which are present in the pleuroperitoneal membrane of the diaphragm, which are the embryological part of the diaphragm. And the diaphragmatic hernia, it can be acquired hernia and the congenital hernia. Acquired hernia may be due to traumatic hernia or hiatal hernia. These are the hiatus hernia. As you can see, this is the stomach. This line is the diaphragm, and above it, esophagus is present. So we have sliding hiatal hernia and we have paraesophageal or ruling hiatal hernia. So sliding hernia and ruling hernia are most important one. Sliding hernia, laxity of the phrenicoesophageal membrane allows the gastroesophageal junction to slide into the thorax. This one. The gastroesophageal junction slides into the thorax, and this is the sliding hiatus hernia. While the paraesophageal or ruling hiatal hernia में क्या होता है कि when the stomach herniates into the thorax alongside the esophagus. This is esophagus, and then the part of stomach herniates into the stomach. This is ruling type of hiatal hernia. Next, we have Raphet pain. Pain arising from the structures served by the phrenic nerve is often to the other somatic regions served by spinal nerves C3, C4, and C5. This is the Raphet pain. Next, we have hiccup. What is hiccup? Hiccup basically is a spasmodic contraction of the diaphragm. And irritation of the phrenic nerve leads to the hiccup reflex. So whenever there is injury of the spinal cord below the neck, the patient is still able to breathe effectively because the nerve root value of the phrenic nerves are C3, C4, and C5. So whenever there is lesion of the phrenic nerve, in cardiac surgery or in thoracic surgery or in trauma, this will lead to the paradoxical movement of the diaphragm. So lesion of the phrenic nerve leads to the paradoxical movement of the diaphragm. First, any question?
No, ma'am.
Okay. ये थोड़ा स्पीड अप था, लेकिन सारे टॉपिक्स बच्चे आप लोगों ने करने हैं, स्पेशली द डायफ्राम, उसके सारे ओरिजिन और उसकी सारी ओपनिंग्स, राइट?
Yes, ma'am.
Okay. I'm ending this meeting now.
मैम सब स्टेज 16 को ही होगी या आगे पीछे होनी है डेट?
क्या चीज बच्चे?
सब स्टेज होनी थी ना 16 को।
बेटे अभी तक वही डेट है, जो स्केड्यूल है
Okay,
वही
ma'am.
फॉलो। अगर चेंज होगा तो आपको इन्फॉर्म कर दिया जाएगा। ओके